Welcome to the Vattikuti Urology Institute at Henry Ford Hospital. What is Henry Ford Health System? Well, Henry Ford was founded in 1915. The hospital is composed of 4 community hospitals with 17,000 employees, over 3 million patient contacts, 90 million admissions a year. We are affiliated with the Wayne State University School of Medicine, and so we are designated as the Henry Ford Hospital Wayne State University Urology Program. What is the Henry Ford Health System? Henry Ford Medical Group is composed of more than 1,200 physicians and scientists in 40 specialties. At least 39 community medical centers throughout Southeast Michigan also incorporated into the Henry Ford Health System. HFHS is not an HMO, but we do have our insurance plan, which is called HAP. Many of you residents will sign up for that upon starting the program. We have a rich history of urology here at Henry Ford Hospital. As you will note in our roster, many of our faculty have relationships with Johns Hopkins University. The first chairman of the department was Dr. John K. Ormond in 1925. He trained at Johns Hopkins University and was recruited by Henry Ford to head the new division of urology at this hospital. He's credited for describing retroperitoneal fibrosis and Ormond's disease, as it was called back then, describing several hundred cases. Dr. Bonet studied at Washington University at St. Louis University and received national acclaim for his work on bladder regeneration. He was initially named the associate surgeon in charge after Dr. Ormond. Following this, our chair was Dr. Cerny, who studied at Yale and the University of Michigan and Harvard. He had multiple interests, including renal transplantation and adrenal surgery. He developed a strong residency program at that time and actually helped install the first lithotripter in the state of Michigan. He was followed by Dr. Farah, who studied at Damascus University in Syria and specialized in treatment of several urological cancers, sexual dysfunction, and infertility. The Vattikuti Urology Institute was founded after generous donation by Mr. Raj Vattikuti. He was a founder of Codevance Business Solutions and actually made most of his fortune in offshore medical dictation. So the VUI is the Vattikuti Urology Institute, and we are the Department of Urology here at Henry Ford. We currently have 15 staff members. This is a map showing where we're located if you're new to the Midwest or the state of Michigan. So we're down here in Detroit, and most of our residents live around Detroit. We have another campus at West Bloomfield Hospital, and so many of the residents live in Ferndale, Southfield, kind of this corridor which we call M10. Here's a couple images of the city. There's a lot of nightlife in Detroit. I'm not sure if many of you residents will get to see it, but it does exist. This is just a picture of the Detroit River, and there's actually a very nice river walk if you get an opportunity to spend some time down there. There are a number of teams in Detroit that residents can be a part of. The Detroit Lions is our local football team, and they have Ford Field downtown. There are tickets available at times through our GME department. We also have Detroit Tigers at Comerica Park, which is a fantastic stadium to be a part of, and it's located right in the heart of downtown. The newly built Little Caesars Arena hosts the Detroit Redwings and Pistons if you're basketball or hockey fans. If you're not into sports, I would encourage you to visit the Detroit Institute of Art. This was actually the site of our graduation a few years ago and is a fantastic collection of art from all throughout the world. The Detroit Symphony Orchestra is also a fantastic venue to listen to world-class musicians. I want to talk a little bit about our residency training program. A few years ago, we had the residents sit down and to come up with a mission statement. We wanted to express what it meant to be a resident at the VUI and the type of leadership and residents we want to train. I just want to read that for you. Our mission statement: the Vattikuti Urology Institute strives to train the future leaders of urologic surgery and medicine, adhering to the highest ethical and professional standards. Through education, mentorship, and research, we develop physicians capable of fulfilling the duties of his or her profession, embodying the principles of hard work, dedication, honesty, and compassionate care for the well-being of our patients and society. This mission statement means a lot to me. It means a lot to all the residents who graduate from here and really embodies the type of graduates we want to have to represent our program. I'd like to now go into our faculty here at the VUI. Dr. Craig Rogers joined the VUI in 2007, and he was elected as the department chair in 2019. He is the director of the robotic kidney program. He did his residency at Johns Hopkins, medical school degree was at Stanford University, and his fellowship was at the National Cancer Institute in Washington, D.C. Dr. Menon is very famous. He's a Raj and Padma Vattikuti Emeritus Chair of Urology, recently stepping down in 2019. He was the director of the Vattikuti Urology Institute, and he was one of the first trainees of Dr. Patrick Walsh at Johns Hopkins University. He developed a robotic surgical program here at Henry Ford and really pioneered an operation called the VIP, or the Vattikuti Institute Prostatectomy, with over 8,000 robotic prostatectomies to his credit. Dr. James Peabody is currently the departmental vice chair. He developed the robotic program along with Dr. Menon. He has supervised several clinical trials. His training was at the University of Michigan for medical school and then residency at Henry Ford Hospital. And he was a recipient of the AUA Resident Teaching Award for 2013. Well, that's me. I'm the program director. I trained at University of Maryland for residency, University of Maryland for undergraduate, and have a special interest in female pelvic medicine and reconstructive surgery. My fellowship occurring at the Cleveland Clinic, and I've been currently the program director since 2015. Dr. Ali Dabaja is currently our Associate Program Director. He's the Chief of Male Infertility and Men's Health. He did his medical school at Wayne State University and is resident here at Henry Ford, followed by a fellowship at Weill Cornell in Infertility and Men's Health. Dr. Hans Stricker is the Chief of Surgery at Henry Ford West Bloomfield Hospital. He did his medical school at the University of Michigan as well as his residency in urology, and he is instrumental in many of the gene therapy trials for prostate cancer. Dr. Wuju Jiang is a senior staff specializing in robotic surgery and oncology. He did his residency training in Korea at Yonsei University, followed by a fellowship here at the VUI, and then stayed on as faculty. Dr. Raymond Littleton is our resident expert in kidney stone disease. His medical school training was at University of Michigan and then residency at Henry Ford Hospital. And he was one of the first urologists to perform shockwave lithotripsy in the state of Michigan. Dr. Frank Holloway specializes in general urology and disease of the prostate and prostate cancer along with erectile dysfunction. His medical school degree was at University of Indiana with residency at Wayne State. Dr. Kandis Rivers specializes in general urology and female urology. She attended medical school at University of Michigan and then completed her residency at Henry Ford Hospital. Dr. Armand Rambatla is our newest faculty member. He completed his medical school education at UCLA, followed by residency at Wayne State University. He then followed up with a fellowship at UCLA in male reproductive medicine and surgery. Dr. David Leavitt is an endourologist and specializes in BPH. His medical school training was at University of Michigan, followed by residency at the University of Minnesota. He then completed an endourology fellowship at Long Island Jewish. Dr. Joseph Haddad is another general urologist in our practice. His medical school education was at Wayne State University, followed by a residency program at the University of Oklahoma. I'd like to introduce Dr. Firas Abdollah. Firas joined us 2 years ago and specializes in oncology and robotics. He completed his medical school education at the University of Baghdad, followed by urology residency training at the Vita Salute University in Italy. This is followed by a fellowship at the VUI in robotics and oncology. And he is the director of the Vattikuti Urology Institute Outcomes Research Division with over 100 manuscripts to his credit. We have two other senior staff members. As I alluded to earlier, our former chair, Dr. Riyad Farah, is still with us in our practice. He specializes in general urology, urologic oncology, erectile dysfunction, and obstructive diseases of the kidney. Also Dr. Stephen Leroff, who trained at Wayne State University, and he has interest in sexual medicine and general urology. We have several training sites at the VUI. Residents will rotate at 3 hospitals, mainly Henry Ford Hospital downtown, Children's Hospital of Michigan, and Henry Ford West Bloomfield Hospital. I'd like to discuss the Children's Hospital of Michigan and that particular rotation. We have 3 excellent faculty members there. Dr. Lakshmanan is the Chief of Urology at Children's Hospital since 2008. He completed his residency at University of Massachusetts and fellowship at Johns Hopkins University. He was the Director of Fellowship Research at Johns Hopkins Children's Hospital before coming to Children's Hospital of Michigan. Dr. Kristina Suson is another faculty member in pediatric urology. Her medical school education was at the University of Maryland, followed by residency at the University of Maryland. She then did a fellowship in pediatric urology at Johns Hopkins and then joined us here in Detroit. Dr. Janae Priest, also trained at the University of Maryland for residency, followed by pediatric urology fellowship at Nationwide Children's Hospital in Columbus, Ohio, before joining the practice here at Children's Hospital of Michigan. Dr. Larissa Kovacevic is a pediatric nephrologist who works closely with the pediatric urologist in the division. She's a director of a behavioral voiding program, and she also co-directs a kidney stone clinic, and she was a research recipient of the 2012 SPU research grant. I'd like to discuss now our training program at Children's Hospital. The Children's Hospital is a vast resource, and so several residents come to that institution to train. Our Vattikuti Urology Institute residents train concurrently with the DMC or osteopathic residents at Children's Hospital of Michigan. There's coordinated scheduling between the PGY3 and PGY4 residents respectively. There's a very collegial working relationship between the two groups. Now I'd like to discuss some of our former residents and their successes. In 2018, we had Dr. Naveen Kechru and Dr. Shriram Elaswarpu both enter fellowship training at Cleveland Clinic and UCLA respectively. Several of our other residents have achieved prestigious fellowships in their training, which you can see on our website. I'd like to discuss a training program at the VUI. We are a 5-year accredited program, and we alternate between taking 3 residents and 2 residents every other year. As a 5-year training program, the residents match into urology categorically, and we also offer a 1-year unaccredited fellowship after residency in robotics. The PGY 1 year is constructed of surgical rotations at Henry Ford Hospital. Just as a reminder, the PGY 1 resident is a categorical urology resident now and not a general surgery resident. In terms of a general surgery exposure, the residents will have selected rotations in colorectal surgery, transplant, surgical ICU, and trauma surgery. Most recently, we've added a new rotation for them in interventional radiology, where they get to perform ultrasound-guided procedures and other image-guided procedures. They spend a total of 5 months on urology. The PGY 2 urology year consists of 12 months in general urology clinics. The residents also have a pager week each month where they see inpatient consults and emergency room consults. The residents work with each of the senior staff in the clinic and in the operating room. The residents in the PGY 2 year perform minor office procedures such as cystoscopy, vasectomies, and prostate biopsies. The PGY 3 year was historically called the floorball rotation, which was composed of 4 to 6 months of endourology. Floorball has a historical meaning to it, which I'll tell you about at some time later. But really, it's an endourology rotation where the resident spends a lot of time doing transurethral sections of the prostate, transurethral section of bladder tumors, percutaneous nephrostomy tube placement, and ureteroscopies. They spend 4 to 5 days a week in the operating room. Also during the PGY 3 year, they do spend 3 months in pediatric urology at Children's Hospital of Michigan and 3 months in the female urology service. Each resident is also given an opportunity for 2 weeks of independent research. The PGY 4 year is really the senior resident year. The residents will spend 6 months as a robotic resident, another 2 to 3 months in Children's Hospital, another 2 to 3 months in the female urology rotation, and they assist in coordinating teaching conferences such as M&M and invited journal clubs. The PGY 5 chief resident year, the residents are expected to have mastered most of the minor surgical procedures and will have a broad experience in open surgery and robotic procedures. They usually will spend 1 day a week in clinic and the other 4 days in the operating room. The residents are expected to have full responsibility for patient care and operative treatment of patients under direct staff supervision. The PGY 5-year is also broken up into Oncology 1 and Oncology 2 rotations for 4 to 6 months each. The Oncology 1 rotation is unique because the residents get to spend a significant amount of time with Dr. Menon to learn from his robotic expertise. The other 4 to 6 months are spent on the Oncology 2 service, performing complex open surgery. The chief resident has the opportunity to then supervise the Urology 2 and Urology 3 residents during rounds and is directly responsible for their education. The chief resident is also responsible for coordinating the teaching conferences throughout the calendar year. We have 2 fellowships at the VUI. One is ACGME accredited. We have an ACGME accredited Female Pelvic Medicine and Reconstructive Surgery Fellowship. We also have a non-accredited Robotic Uro-Oncology Fellowship for 1 year. We also have a number of research fellows that work with us throughout the year. One of the unique properties here at the VUI is our international medical missions. Over the past several years, we have had international missions to Benin, West Africa, Ghana, West Africa, Honduras, and India. Here are a few pictures from some of those trips. These are some of our current residents, Dr. Sood and Dr. Borchert, on a trip to Honduras, where they spend a lot of time doing kidney cases, sometimes in the dark, sometimes with good electricity. There's a lot of children in Honduras, and there's an excellent time bonding with the children at the local school next to the hospital where the residents work. Dr. Peabody has been going to Benin for several years in West Africa, and here's just some images of him working independently. Sometimes the mosquitoes are quite aggressive, and so often when you have to pack your own mosquito spray during these cases. More recently, I took a trip to Ghana, West Africa with our past graduate, Dr. Dan Pucherel, and some faculty members and residents from the University of Michigan. We did joint rounds and operating, and you can see in the operating room the videos were provided for the medical students to learn from those cases. We also spend time seeing patients in the pediatric ward and performing endourology in our Ghana medical mission. Many of the residents found time to have fun on these trips, and this was just a rope bridge that we took an excursion and walked around during that visit. We have several academic conferences at the VUI. Every Wednesday we have grand rounds. Once a month we present morbidity and mortality conference and have a monthly pediatric urology conference. There are topic-oriented presentations on Tuesday afternoons, and this includes discussions in infertility, AUA core curriculum topics, and pathology. There's also a female urology lecture every Thursday morning and a conference, followed by journal club 6 times a year. Tumor board is held Monday mornings, and there's a pediatric radiology conference at Children's Hospital. There are several other conferences that the residents can attend. We have our own visiting professor, which is a Rafat Dagher conference once a year. We have the Michigan Urologic Society conferences that our residents present their research, the North Central section, and the AUA. Each resident who's presenting research gets fully funded trips to present at national meetings. We also pay for the residents to attend the AUA Board Review course and the AUA Basic Science Review course. I'd like to discuss the call at Henry Ford Hospital. Our residents take call at Henry Ford Hospital only every 4th night, with 1 weekend per month on call. Residents post-call get to go home at 10 a.m. the next day. At Children's Hospital, the residents take call at least 2 weekends a month, and then every other night call at home. Chief residents and senior residents take call for 1 week at a time. With that, I'd like to conclude this presentation of the Urology Residency Training Program at Henry Ford Hospital and the Vattikuti Urology Institute.